Did you know that your thyroid gland is a powerhouse for regulating both body temperature and energy throughout the body? If that's new information, or if you're curious about how it all connects, stay tuned, because in this episode I'll be breaking down the essential role of the thyroid and how acupuncturists like you can support thyroid health to achieve better patient outcomes. My name is Dr. Jeremy, and I help acupuncturists like you achieve breakthrough results with advanced holistic techniques. If you haven't subscribed yet, be sure to click the subscribe button so you're notified every time I release a new training video. I also provide a free downloadable resource with every episode. This time it's called Key Points to Understanding Electrophysiology of the Thyroid for Acupuncturists. Don't forget to grab your copy before you go. Ready to dive into thyroid health? Let's get started.
So let's start with the thyroid gland. It's an incredible gland. 40% of the thyroid function is for body temperature, and body temperature is really important because just a quarter degree in temperature difference, like let's say colder, slows down more than 100 enzymatic processes. Thyroid is super important because it also controls 60%, or 60% of the thyroid function is for total body voltage. So if you're used to using an acugraph and everything is low, all the channels, that's either a thyroid issue or a gallbladder channel issue. This book is great. It shows you, it was written by Dr. David Brownstein, shows that 90% of Americans have undiagnosed hypothyroid, making this a really good business plan in the United States because the endocrinologists miss it. And functional medicine misses some of it too. Primary causes of hypothyroid is fluoride. Remember we said fluoride kicks the iodine molecule off of the thyroid hormone, creating a fake thyroid hormone that shows up normal on standard blood tests. Soy can lead to thyroid issues and iodine deficiency. Iodine's role. Iodine's essential for the production of thyroid hormones. As you know, it's a significant cause of thyroid disorders, including hypothyroidism and goiter. Iodine and bromide, found in many processed foods and environmental sources, competes with iodine for uptake in the thyroid, exacerbating iodine deficiency. So they removed iodine from our food source somewhere along the way and put bromide in there, which is one of those similar to fluoride, to get rid of iodine in our body. So symptoms and diagnosis for thyroid. One is that intake form. You'll notice in there a hormonal questionnaire that you score, and you can pretty much, for our purposes, diagnose your patient with a hypothyroid issue. Common symptoms are fatigue, weight gain, depression, cold intolerance, and dry skin. Remember, these are symptoms. So if they have any of these symptoms, try to correlate it to make a proper diagnosis, which is acuchannels and thyroid leak. Now, Dr. Brownstein argues that many cases of hyperthyroid are missed or misdiagnosed due to over-reliance on TSH tests alone. You'll see the Western medicine, like the primary care, just test TSH. And then the endocrinologist will usually just test TSH plus free T3, free T4, and they don't usually test for that fake thyroid hormone, reverse T3 or reverse T4. Now, natural treatment, if you need Gucci for this, use of natural desiccated thyroid is way better than synthetic thyroid, like levothyroxine, for treating hypothyroidism. It contains a full spectrum of thyroid hormones instead of the synthetic, which is very limited and synthetic. And they probably started mixing GMO stuff in there anyway. Can lead to, so hyperthyroidism, because we can treat both, can lead to symptoms like weight loss, anxiety, tremors, and heart palpitations. Iodine deficiency, paradoxically, can contribute to both hyper and hypothyroidism. So no need to ask me, okay, can I give iodine to my hyperthyroid patient? Well, the answer is yes, because of this slide. because iodine deficiency can cause both hyper and hypo. Iodine, along with other nutritional support, can help manage hyperthyroidism when used carefully under medical supervision. Hashimoto's. I get the question, can I give iodine to a Hashimoto's patient? And I couldn't find the study, but there are studies that show Hashimoto's autoimmune, so eating away at the thyroid, causing an acute hyperthyroid issue until the thyroid's scarred, and then they turn into long-term hypothyroid. Hashimoto's can be triggered by iodine alone without a cofactor like selenium. So my favorite iodine plus, and we'll go deeper into it when I get to the Gucci section, it's called Iodine Plus. Dr. Tennant sells it, tennantproducts.com. That's in your Gucci building block guide for download. It has that selenium cofactor in there. I like it because one capsule is 12.5 milligrams. And yes, I did say milligrams because that's scary for Western medicine. They're like, oh, you have iodine deficiency? Okay, take 200 micrograms a day because we don't want to give you too much iodine. Well, that is not going to work. 12.5 milligrams is a safe dose. We know that because that's the average amount of iodine in Japanese diets from foods. And so we can start at that dosing. Iodine doesn't taste so great for everybody, so capsule is good. And it's one capsule a day for 12.5, and it's got those cofactors. Not only does it have the cofactor for selenium for the thyroid, but iodine is needed for stomach acid production, and the flip side of that is sodium bicarb production into the venous system of the stomach. So if there's no iodine, how can the stomach make indirectly sodium bicarb, right? And directly, how can it make stomach acid? Iodine deficiency can trigger or exacerbate Hashimoto's in susceptible individuals. Nutritional support, in addition to iodine, selenium, vitamin D is necessary for reducing autoimmune activity. So if you have an autoimmune patient, think vitamin D deficiency as one of your Gucci. Vitamin D makes up cellular membranes. It's an integral part of the immune system. Do we need to make up cellular membranes? Well, the whole point of this class is how can we regenerate cells, so there might as well be some vitamin D. I said you can't get enough from the sun, especially because there's reduced rates of sunshine on the earth these days. So you have to supplement. The way I like to supplement vitamin D is 30,000 IUs for the first month and then drop it down to 1,000 a day. The way they like to do it in the wound care center is 5,000 IUs a day. Forever. And a blood test for vitamin D is pretty good. You want it to be up and above 90, which again, I'm conflicting with a lot of Western medicine doctors, but you want it to be above 90. The Eskimo population who eats a lot of vitamin D, and they're in the sun, where maybe their area of the world's getting more sun sometimes, half the year, because the other half they're not getting enough sun. They eat seal blubber with a lot of vitamin D, and their levels are well up above 100, and they're super healthy in terms of vitamin D. Maybe not all of them, but in terms of vitamin D, they got good vitamin D levels. Graves' disease is hyperthyroid autoimmune disorder. Graves' disease is characterized by an overactive thyroid leading to symptoms like anxiety, weight loss, and bulging eyes. Iodine has a role in Graves' disease. Immune system modulation, there's a need to address underlying immune dysfunction in Graves' disease, and hopefully you can think of a handful of treatments to address immune dysfunction. So if the immune system's attacking the thyroid, back to right liver ear area, a lot of the immune system comes from or lives in the liver and the spleen organs. So we can really stop progression of a lot of autoimmune disorders. Diet and nutrition. Gluten has been linked to thyroid disorders. There's a potential link between gluten sensitivity and autoimmune thyroid disorders. So it's a good idea to advocate for a gluten-free diet. I'm not sure if it's the gluten. Maybe Sean could speak more about that, or it may be the glyphosate, or it may be some other toxin that's unidentified on or near that gluten food. But what's it doing? It is definitely stealing chi from the small intestine organ. Remember I said when you think small intestine channel, feeding the inner lining of the small intestine organ, think autoimmune. The thyroid, this is talking about detoxification. The thyroid is also takes on dirty electromagnetic frequencies. So it's highly affected by dirty electromagnetic frequencies. And environmental toxins such as halides, bromide, fluoride, we already said that, can interfere with thyroid function. This is blood testing, so beyond TSH, it's a mistake to only rely on TSH. You should test for T3, T4, reverse T3, and thyroid antibodies for a more accurate diagnosis. Depending upon what state you're in, certain states are primary care licensed where you can order these blood tests. Good luck getting them covered by insurance, but maybe you can convince a patient to get the blood test, and then that'll help your case. Or just treat them because you're able to diagnose it by linking correlating factors. We already went over fluoride. So what, oh, don't look at that. What channel feeds the thyroid? From what we learned. Somebody said stomach spleen. Remember, stomach spleen feeds the entire endocrine system of the body. Passes by stomach 9, passes right by the thyroid, right? So the stomach channel feeds electrons into the tissue of the thyroid gland for cellular regeneration and function. So can you think of another channel which may affect the thyroid gland besides stomach spleen? Anybody? Scream it out at home. Somebody said small intestine. I would say yes, indirectly. I'm thinking of another. And remember, take it easy. Don't think so hard. Remember, big categories of channels. Fire channels. Thank you. So you weren't wrong. You were just 1/4 correct. Fire channels. Why? Well, doesn't the autonomic nervous system play a role in how much production of thyroid hormone the thyroid produces? Yes. Gucci subtraction. If they're drinking tap water, get them to stop. Water, we're made up of water, so that's a major Gucci building block. Our patient population gets more and more dehydrated. We're probably born 70-80% water, and then by the time the average patient's 80 years old, maybe they're 50% water. You all drinking water? And if so, is it clean? Because every time your patient drinks tap water with fluoride or chlorine or some other chemical, they are chi sapping themselves, and it's your job to get them to stop. My favorite water these days is distilled water, and I add something called 4 salts, which is also in your Gucci building block guide, which is sodium bicarb, a tiny amount of calcium, tiny amount of magnesium, and a tiny amount of potassium. It's delicious. I can't drink water without it these days. Now, you can get away with reverse osmosis, and you just need something to pull the chemicals out of the water.
So what did you think? Feel free to place your comments or questions below. Now remember, I created this great downloadable resource. The link will be in the description area. Be sure to grab that. Now, I hope you enjoyed this episode. If you did, click the like button, and if you have any colleagues that would benefit from this information, feel free to share the link with them. And for further information regarding my classes, you can visit electroacupunctureinstitute.com. I'll see you next time.